we got a letter from the immigration, and she read it to him at work, and that they were being deported, and the wife just had a baby, less than 3 months old.
Hey, welcome to News You Can Use. I'm your host, Brandon Gomez. Nurses, doctors, PSWs, they're all healthcare heroes. Well, that's what we called these professionals during the height of the pandemic. In fact, the Canadian government even opened up a pathway that was supposed to make it easier for refugees working as healthcare workers to become landed immigrants. But listen to this, many of these heroes are now facing deportation. Yeah, before we get into those details, I need you to do a few things like subscribing to this channel, tapping that notification bell, don't forget to smash the like button, and make sure to follow us across all of our social media. The details are in the description below. So Helen-care, it's an agency that places many internationally trained healthcare workers who had come to Canada as refugees in long-term care homes and hospitals who are short on staff. They were literally critical during the pandemic. Well, the agency's owner, Helen, says many of those same workers then applied for permanent residency after working way over the minimum hours needed for the healthcare workers' permanent residence pathway. But they were denied and are now facing deportation after putting their lives on the line to take care of sick Canadians. Today, Helen is here to advocate for her employees who she said would be here themselves if they weren't terrified of retribution. Let's bring her in. Helen, thank you so much for joining me here on News You Can Use.
Thank you.
I want to dive right into it because I know that you have your own PSW agency, correct?
Correct.
And you work with some healthcare heroes.
Oh yes, yes,
throughout this pandemic who kept our healthcare system alive.
Yes.
What was that like? What was that these last 2 years like for you and your workers?
Oh, it was a very tough time. I have some of my staff tested positive.
Yeah.
Some were sick, some were okay, and right after 14 days, they're right back in there working, doing 12-hour shift every day. It was a challenging time, and I was so proud that our community came out.
Yeah.
They wanted people to work, and they showed up.
How many workers are we talking about that come through your agency?
Oh, we're talking over 500.
Wow.
Over 100 of RNs, over 50 of RPNs, all the way to Windsor. We
So
staff
you service
Windsor.
all
Oh
of
yeah,
Southern
everywhere
Ontario.
in Canada.
Okay.
We service everywhere there's healthcare that they need staffing, we staff them.
So what's happening right now with some of your workers?
Few months ago, I started getting letters or emails from my workers that they were demanding letters from the immigration. One that actually hit me was the one few weeks ago, called me and said, the wife called her and said, hey, we got a letter from the immigration. And she read it to him at work, and that they were being deported. And the wife just had a baby, less than 3 months old baby.
Right.
So cut long story short, it turns out to be that the immigration were saying that he didn't have enough hours, and then we send in the timesheet, and then from not enough hours to, oh, well, you don't qualify. We don't believe that you qualify to
Enough
be a
working
PSW.
hours.
But he did have enough. He have over
Right.
2,000 hours from my agency. And then when I start going back and check, I realized that some of my staff were actually rejected. They have the hours. The hours are there. The government said 2,000 hours plus.
Yeah.
They have them, even more than that. But they've been refused for one thing or the other. Either they've been refused by, oh, you're self-employed, you're a self-contractor, so you don't pay tax, so we're not gonna, you don't qualify. Or you don't, your hours, you did 1,900 hours on COVID and 100 non-COVID. So they started coming up with different reasons why these people were getting rejected.
How many people are being affected by this situation?
Hundreds, trust me, hundreds of them. They are so scared to speak up because they're scared that if I speak up, maybe that might even make my matter worse.
Are many of your workers permanent residents, or what is their documented status?
They're still waiting for, they're here already,
right?
But they don't have their documents as a permanent resident.
Got it.
So for you to get the government initiated that pathway for you to get your resident, we need you to work some certain hours on the COVID.
Right. Oh, so this was a stream to allow people to get to Canada, so they came
And the
through
ones
that
that were,
stream.
yes, and the ones
Got
that
it.
were here already. If you're here already,
Yeah.
and your PSW work,
Yeah.
get these hours, and then you get your pathway.
Got it.
So
So they put
now-
in the time, they put in the effort,
Yes.
because this is what the stream, the program said you need to do to get.
Exactly. What now start happening is that they're refusing some of them with different reason, ignoring the hours that
Outside of the
they work.
hours.
So then what happened to the hours that they work? Are we just gonna just let that go away and say, hey, yeah, I know you work 2,000 plus or 3,000 hours, but because your working permit expired 2 days ago, you don't qualify. Or because you work 1,800 hours on COVID and 200 hours on non-COVID, you don't qualify.
I hate asking this question, but I mean, I think it's going to be on a lot of people's mind, but do you think there's a race factor at play here?
I have always tried my best to always kind of stay away from race part.
Right.
So they will not say, oh, here we go again with the race card. Why are so many minorities that are here, immigrants, are being deported for one reason or the other? People that have been here for 10, 5, 7, 8 years, have families, and we're not giving, and we're not saying, okay, if you've been here for so many years, let's find a way. We're not doing that to the minority, the people of black colors and mixed colors. We're not doing that. What we're doing, we put it into consideration of other race. We're sending more people in, and we're deporting more people out.
Yeah.
But the immigrants here already, why are we not utilizing the immigrants that are here? Why are we
Especially if they're already contributing back to
Exactly,
society.
they're here already. There's so many deportation among men in our community is leaving our mom overwhelmed, taking care of our kids by ourselves. So a race play a huge role in this immigration factor. Let's say, for example, the Ukraine. My heart bleeds to what is going on in Ukraine. I think they deserve the awareness,
accommodations,
yes,
yeah,
the accommodation that is being provided. Let's not forget, other people need accommodation here too.
So when they're watching this situation unfold, they're reading these letters, they're seeing what's happening
And
in
they're
other
still working.
countries, right? You know, like you said, the situation in Eastern Europe. What's the emotions around that? How are they feeling around that?
Why not me? I'm here already. Why not me? Why I'm being sent home? What crime did I commit?
A lot of people watching this are probably going to wonder, how can I help? What can I do? But is there anything that people can do who are watching
I
this?
think they should reach out to the government. They should reach out to the parliament. And we need to look deep into the immigration system. There has to be something. Should there be, if you've been here for a period of time, you have families here, should we say, okay, work for 5 years, be on probation, let's see what you can do, let's see what you can contribute. After a certain time, then come back and apply for a green card, and then we see, then with good behavior, then we can see what to do from there. Something has to be done. We cannot just continue creating a habit of deporting people and say, hey, we don't need you anymore. But when crises come, we always know what to say and who to reach out to. Because, think about it, during the pandemic, they said, work certain hours and you will get your pathway. Who do you think is going to come out?
The most vulnerable. Helen, thank you so much for your being so candid and for having the courage to speak on this. and we'll continue following up on
Oh,
this story.
thank you so much. Thank you for having me. I really appreciate this platform. Thank you.
Hey BG Squad, thanks so much for checking out our channel, and listen to this, we have more great content for you, like this video right here and this video right here. By the way, don't forget to subscribe to this channel right now and tap that notification bell.